Hey everyone, Dr. Ashley here. Well, this week's topic is for the ladies. And guys, maybe some of you should listen up too. What I'm going to discuss this week is why we need to stop blaming the female athlete's body for injuries that occur in sport. We need to stop talking about the Q angle relating to knee pain and things such as hormones when it comes to ACL tears. Yes, maybe some of these things do have a correlation to injury. However, research isn't definitive. So let's start talking and talk about this a little bit more. Are you a female athlete who has been told that your hip angle is a cause for your knee pain, or that maybe your hormones are what caused your ACL tear or some of your ligament laxity? Well, we need to change the subject. But before I get started in talking about this a little bit more, make sure you hit that subscribe button below. And if you're enjoying our content, share our channel with your friends. Similar to any athlete, injuries that happen in the female athlete are multifactorial. We have to look at this from a wider spectrum and not simply just talk about the female body when it comes to injuries sustained during sport. We have to look at people's sleep, stress, and kind of everything that goes into an injury, such as training age and also training load. So what we really need to do, instead of saying, oh my goodness, your Q angle is the reason, why may we be having these issues in the first place? Not our body, but what about not being strong enough? What about trying to ask your body to do a little bit too much too fast? And what if you simply aren't prepared for what you're asking your body to do? We have to think about it like that instead of just saying, oh my goodness, our hips are so wide, we have knee pain. Well, maybe it's that you're not strong enough, or your landing mechanics aren't necessarily all that great because you've never worked on it before and you need to be taught that just a little bit more. If we look at what the research says, there's really no direct correlation between things such as estrogen and elastin and our hips and our knee pain. When we're looking at the female body, we definitely have to look at it from a different kind of perspective. If we're comparing females to male athletes, there's one thing that can be heavily noted in research, and that is male athletes start weight training sooner. They start doing things such as deceleration drills and kind of these patterning drills earlier than females. A lot of young female athletes are not introduced to a weight room until their first year of college, or they're never introduced in general. And they think that going to the weight room is going to make them this big, bulky individual. However, that's not true. We need to start training our females earlier. One thing that they've actually shown relates to sports-related injuries in the female population is training age. How well or how long has this athlete been training for this sport, and how well are their movement patterns that have to do with this sport? And if they're not all that great, or if they're not well developed in their movement patterns that correlate to what they're trying to do, more than likely an injury is going to happen. So we need to think about that just a little bit more. Now, it has been shown that getting females to do things such as deceleration drills and landing mechanics drills and kind of these neuromuscular type of components to sport really does help athletes decrease their risk for injury over time. If we continue to just let female athletes play their sport without any external strength, then yes, sometimes injury rates skyrocket because those athletes do not know how to handle their bodies well. And that is something that overall happens across a wider spectrum. If we look, there was actually a study published, say 35 years ago, that said that men and women should be training similarly in a weight room, especially for injury prevention purposes. Why don't we do that? Why hasn't that been implemented? And that's a really good question to be asking yourself, especially if you're a coach or a female athlete, or say a parent of a female athlete. So next time somebody tells you that you have an injury simply because you're a female, tell them not necessarily. We need to look at this a little bit different, and maybe we need to get you doing a little bit more strength training, or maybe we need to practice the patterns associated with your sport. And finding the right person to help you with that is going to be extremely important. So that's all I have for today. But as always, if you have any questions, don't hesitate to post them in the comments section below, and we'll be sure to get back to you as soon as we can. Oh, and I'll be back next week with a little bit more information and a special guest here with me.